Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. Today on the program, a proposal to lock down the entire National Capital Region.
I'm not saying that there is no need, but we will continue to reassess the situation.
Following a rapid surge of confirmed coronavirus disease cases in the country.
Avoid crowds if it's not that important or urgent.
But local leaders say not too fast.
Let us wait for Saturday, and Saturday we will decide based on the outcome of the first step we have done.
And later, testing suspected coronavirus patients made easy and more affordable. And how close are we to finding a cure? Albay Representative Joey Salceda and Pharmaceutical and Healthcare Association of the Philippines Executive Director Teodoro Padilla join us live. Thank you for joining us. I'm Pinky Webb. President Rodrigo Duterte says it's too early to lock down Metro Manila amid the coronavirus outbreak. Mr. Duterte warns of economic losses should the country impose a regional lockdown. Health Secretary Francisco Duque III echoes the president's stand, saying that it's still premature to lock down the entire National Capital Region without solid evidence of a community spread. But how do you actually strike a balance between economic needs and ensuring public health? Let's go straight to the source of the story. Someone definitely who can explain that to us. House Ways and Means Committee Chair and Albay Representative Joey Salceda. Good morning. Sir, are you still calling for a lockdown? We have 33 confirmed cases.
The more they say no, the more I will say it's necessary.
Why?
Una, hindi naman tayo nakapag-test masyado. I-add mo lang yung negative plus positive. Wala pa tayong 700. We are one of the lowest tested countries with all the windows of vulnerabilities. Tourists, Chinese POGO workers, and of course all our imports. 30% are essentially from China. So there's a huge vulnerability there. So kung nag-testing sana tayo, wala pa tayo 700 eh. Isa tayo sa mababa sa buong mundo. 6 per million.
Are you telling me,
Number
sir,
2.
Let me cut you there. I hope you don't mind. Are you telling me that you don't believe in the numbers that the Department of Health came out with in the past prior to yung itong biglang from 3, naging 10, naging 20, naging 33?
Ang sinasabi ko, sa number of tests, dapat ang test na marami. Katulad ng South Korea, 36 million lang sila pero 142,000 tests. Kaya alam kagad. So, dasaran kagad yung kung nasaan, na-identify kagad si virus.
So the numbers was not accurate. You're saying the number
No, we have a
is not
700
accurate.
tests and we should have tested more. So pag hindi ka kasi nag-test, ano yung dulo? Ang dulo, dapat may surge capacity ka. 101,000 beds lang tayo dito sa Pilipinas. 47% public. So, pag tinignan mo yung public side, kasi doon mapupunta sila lahat, katulad doon yung referral hospital sa Bicol, it's already operating at 350% occupancy. So saan ko pupuntahin yung mga buntis? Na apat-apat na sa isang kama.
Where do you send them?
Well, of course, kailangan may kausapin ka na kung saan you cannot definitely yung regular patients mo. We have a problem simply because, pakita mo lahat ng listahan niyo, puro nasa private. Wala na halos sa RITM kasi hindi na kaya.
In fact,
All of them
Congressman,
are
they're
in
saying
private.
that there are 3 hospitals where they can be taken na sa
San
gobyerno
Lazaro,
po.
basically, yung RITM
At lung center.
At lung center.
Is it lung center or kidney center? I think it is lung center.
So, doon ang final referral nila. Pero ang point ko doon, yun sa pag-manage ng mga yan, kung kailangan mo na i-isolate, kailangan mo bigay ng supportive care, I don't think we have prepared for a surge, for that surge capacity.
And so, you're saying...
Therefore, you need to slow down the transmission. So I posted last Sunday, number 1, 30% kagad, maset aside mo, cancel all classes.
What's 30%? Let's be clear on that.
That's virtually 30 million students. 20 DepEd, 25 million plus, of course, 3 million po doon.
So your suggestion was number 1, sir. Go ahead.
Cancel classes. Number 2,
Which they did.
Yeah.
Okay.
Pero may NCR lang. So pag nag-uwian yung ganun din. Out of 4.1 million students in Metro Manila, I would say that about 600,000 are from the provinces.
And there's a big chance that this
I don't know.
600,000,
Kasi
Congressman?
there was no social distancing before. And there was no testing
I'm
before.
gonna go to that a little
No,
later on.
and number two, ang second ko was work stoppage. Stay at home. Grand staycation dapat. Para we would immediately be able to isolate the virus. Asan ba talaga siya? Sino meron? Lumalabas, lahat nasa Metro Manila.
Because the problem, Congressman, I
Hindi
guess,
tayo
is
nag-test.
nakikisalimuha tayo sa mga taong hindi natin alam kung exposed. Tama ho ba?
Opo.
So, if you isolate, if you stop classes, if you
At
suspend
walang
them,
dahilan ng DOH na magsabi na wala silang kakaya mag-test. Dahil in-offer sa kanila ng isang kumpanya dito, murang-mura, 1,000 lang per test. Tapos hindi nila i-handle yun. I think they should be made to account
for that.
Yeah, because
Why didn't they allow that, sir?
I don't know. I don't know. As early as February 2.
But
This company offered 1,000 kits at 1,000 pesos and more. Because it's a big company, they can easily supply us with all the kits. Then suddenly, the number of kits became a problem.
yeah,
We asked DOH, what did they do with that letter to them?
we should ask them
They
that.
should
So
be
there was a
asked.
pharmaceutical
They are
company.
accountable.
Yeah.
It's
But
a Swiss company.
But Congressman, you're also looking into this. The House is also looking into how government's response is the DOH. Didn't you ask them?
Tapos na kasi yan eh. Kailangan nila talaga mag-test tayo para alam natin kung nasaan. Kaya ayoko na sana yung buksan eh. Pero pag ganun, nagdi-denial tayo kasi hindi tayo nag-test dahil wala daw test kit. Ano ginawa nila? Wala pa nga 1,000 ang testing natin eh. 660 negative, 34 positive. Binawasan pa na 3 kagabi. So 31 lang. So ibig sabihin, ang na-testing lang natin, wala pa 700 or less than, or almost 6 per million.
I actually asked them about that. How many can be tested in a day? If I'm not mistaken, sir,
250 daw.
said
250 daw,
300.
pero walang kits.
Wala. Ganito po yun. Ang pagkaintindi ko, Congressman, is this. There are no rapid test kits in hospitals. What they do is they take a sample and then they send it to RITM.
sabi
And the
nila-
RITM can test 300.
3 weeks ago, they said that they will devolve it to subnational testing centers. And they haven't done that. So, asan yung mga labas na sa Baguio General Hospital, kesyo nandun sa Soto, kesyo nandun sa...
Nothing.
Ang point ko dyan, mga panahon kasi nito, ay hirap naman iisip, pero kung nagdadahilan ka pa, tapos para lang sabihin na... Kaya, yun ang cost ng fear ko. We did not test enough.
Hence the number of positive COVID-19 cases.
Hence, suddenly may nagsusulputan.
Yeah.
ng ganyan.
And then now, it was a rapid increase. Hindi ho ba? I mean, we were at 3, Congressman, for the longest time. Tapos biglang one weekend, I think it was Friday last week, if I remember right, from 3, naging 6. Bigla na lang no Saturday, naging 10.
So, nandun tayo sa work stoppage.
Okay.
Ang work stoppage, sa NCR ko lang talaga kasi nandito lahat ng virus. Hindi, sabi ko, it's close to a lockdown. Sara mo lang yung dalawang SLEX and LEX. 80% hindi na makakapasok ng Metro Manila. Eh. So, hindi ganun yung kaano. So, sabi nila, bakit hindi pa sara yung East? Well, sabi ko, hindi. Importante lang yung SLEX and LEX eh. Pera sa pagkain, pera sa medicine, pera po sa mga health personnel. So, like doctors, nurses can pass. So, kaya ang point ko doon is, ano yung disruption na sinasabi? Ang Metro Manila, ang isang linggo niyan, 125.7 billion. 40% po niyan ang madi-disrupt mo. Bakit? Kasi pwede ka pa naman pumunta ng tindahan, bumili ng suka. So, hindi ko sinasabi hindi ka na pwede lumabas. So, pwede ka pa rin pumunta ng palengke. Pero, that's about 0.58% of the GDP of Metro Manila.
Can I ask you, sir, because I know you're very good with numbers, in 1 week, if there was work and
Stoppage.
and class suspended, how much do we lose in one week?
0.58% of GDP.
Magkano ho yun?
125.7 in gross. Ang ibig sabihin niyang gross na as if na zero talaga. Pero hindi naman kasi zero eh. Di ba? So, ang estimate namin, 40% talaga ang napaparalyze ng isang lockdown. So, in terms of 21, sa buong Pilipinas, 0.21% yun.
0.21% of
Okay. Pero pinag-aralan ko yung SARS, MERS-CoV, AH1N1, ano yung behavior ng Metro Manila. Bawi agad in 6 months. Kasi nagkakaroon ng 20% spike. That's
increase, no? Once the problem is over.
Because
Okay.
one, ang nagkakaroon po tayo ng yung mga businesses, they spend more money to rebuild. Yung customers, they spend more money after deferred consumption. And ang problema ko ganito, Pag hindi ka nag-lockdown, tapos nagmamas transmission, mas mahirap at mas malaki po epekto. Nasa 4.8% full year reduction sa Metro Manila at sa national is 1.7 reduction.
We have that on air. Ito po yung scenarios na you had released, no?
Three.
No lockdown but mass transmission occurs as a result. Ayan po lumalabas. Impact on NCR GDP, 4.8% full-year reduction. Impact on national GDP, 1.7% full-year reduction.
Ang problema ko, kung di ka nag-lockdown, nag-mass transmission, katulad ng sinasabi doon sa mga footage, magla-lockdown ka rin naman pala.
Unahan mo na.
0.21 lang ang epekto. Kaysa naman 1.7, 3.1. Yung 0.21 naman mababawi.
Yeah.
Ang issue, napakasimple. Gawin mo to para hindi mag-viral o viral to sa kakagawa. So, I think what they call premature is preemptive.
Look at this video, Congressman. Because of talk.
Because of me.
Hindi naman. No, I'm not gonna say because of you. I don't know that for sure, but talks of a possible lockdown by you, I believe also Congressman Abante. And then because yung pagdami po ng kaso ng COVID-19, bigla po kasi nag-spike. Ano po? Some will really say there was panic buying. Even my helper at home, sinabi na napakahaba ng linya sa isang grocery store noong Monday at nagkaubusan daw ng toilet paper at alcohol. Yung po kasi mga ganyang suggestion causes something like this. What do you say to that?
Well, unang-una,
Is that a big deal, sir?
It's first, it is the kind of behavior that is probably dysfunctional at first, but essentially, it tells you that people are concerned, finally. Second, it means that itong mga ibang players sa society are not doing their part. Ibig sabihin, alam mo na pala na magkakaroon ng ganyan, di sana meron ka pwede kang mag-implement mga measures para ma-minimize po yung kung bibili ka ng 1 kilo, ginawa mong 7, yung 6, inagaw mo sa kapitbahay mo. So, I think the supermarkets have a role to play. The DTI have a role to play.
They should also monitor that. Hindi ho ba, Congressman?
They can control that.
Yeah.
They can control
They
that.
can. They can. All right.
Because we are already in a state of public health emergency. And of course, we are in Code Red Sub-Level 1. Ang sinasabi nila, mag-lockdown tayo after sub-level 2. Doon sa mayon, pag sinabi ng FIBORS, alert level 2, ginagawa ko yung pang 3. Para hindi ako nabibigla. Dahil kinabukasan, bigla na lang nagiging 4. Tingnan mo yung taal.
Your style is preemptive rather than reactionary. We'll be taking a short break coming up. A work-from-home alternative or a 4-day work week option to prevent the spread of the coronavirus disease. Albay Representative Joey Salceda will still be with us after the break. You're watching The Source on CNN Philippines. Our guest today, Congressman Joey Salceda. Congressman, here's the thing. When the President was asked about this lockdown, ang sabi niya, parang masyado pang konti yung mga infections right now for a lockdown. Let's listen to what the President said. This happened about 2 nights ago.
We have not reached that kind of contamination. Iisa-isa lang. With this transmission, you want to close down the economy at this time. There will be a time, I suppose. I hope not. I hope God will have mercy on the Filipino people. There might be a time, pero at this time you want me to. It's too early.
There you go, Congressman. It's too early for the President.
Ito po ang prueba ko na ang lockdown works. In Mexico City,
Hindi ko po maintindihan.
well, basically, this is the chart of infection. Nung mag-lockdown sila, bumagsak, halos 0.
Yeah.
Tapos, nang akala nila, achieve na nila, tinanggal nila lockdown, sumipa ulit.
Yeah.
This is also from Hubei. And there are 3 lines basically, but you cannot see it. But I can leave it here. Essentially, it says, very
I'll do it, sir.
simple.
Here. I'll show it here. Kayo po, you can point. Yan.
Very simple. It says here, after they impose a lockdown, basically, people stay at home. Kasi nung una, no exit, no and ano lang. So, nung ginawa na nila, tingnan mo yung yellow, which is basically the infection, and the green is the recovery. mas mababa na ngayon yung infected kaysa recovery.
In a situation like this, Congressman, it's
It
supposed to
works.
be
A
who
lockdown
kaya the
works.
economic managers of the president should suggest this to him? Palagay niyo?
Well, we should define the parameters of the risk basically and consequences. Pag ganito naman, it's all about consequence management. So, ang sabi ko nga, you should be prepared with measures to counteract any potential economic impact. Whether you like it or not, there will be negative impact. And the market's already suggested we're way below. We're less than 20% from the recent 8,000. So we've dropped like, I don't like the adjective, but we dropped. So kailangan mo po ng tinatawag kong Eco-19 versus COVID-19. I just listed 19 measures and it's so easy. Essentially, it protects the workers. You can, unang-una yung mga SMEs, yung mga nagsusupply sa Shumart, yun ang worry ko eh. Kasi wala nang pumupunta sa mga malls. So walang konti ang benta. So yung mga nagsusupply dyan, siyempre baka magtanggal ng trabaho. So i-postpone mo muna yung kanilang mga liabilities.
How do you suggest?
Di ka muna pwede natin sabihin ng SSS, huwag ka muna maningin lang employer share.
Okay,
Cash flow mo yan.
those things.
Tapos yung BSP can provide relending facilities to banks exposed to a lot of this.
So let me bring this in, Congressman, before you go. I know there's a hearing also again today, but yung pong sinasabi na kailan mag-self-quarantine ang mga empleyado because you can't just think about yourself, your family, and your co-workers
Hindi yung
as well.
gagana
sir.
kasi pag alam mo mawawalan ka ng pera,
Papasok ka.
Papasok ka.
So what's the solution to that?
Unang-una-
Ayaw mo magpa-self-quarantine kasi ayaw mong matanggalan ng kita.
This is where the national
National
the
government
national
supplement.
welfare
Okay.
offsets private welfare.
How? But who should come in?
Pero after government says lockdown, work stoppage, o yung in-approve po namin sa House, 35 work week, basically 4-day work week lang. O pwede naman after that, then you manage the consequences nga. You manage the consequences of your kaya dapat handa ka.
But who comes in to take care
Government.
of employees who?
Unang-una, sabi ko, expanded TUPAD. Yan po, emergency employment. Kumbaga, mabigyan lang natin. Kumbaga, ayusin niya yung bahay niya, babayaran ka ng gobyerno. Ginagawa naman po kasi yun. At saka ma-identify naman natin kung sino dito talaga affected eh.
Alright.
So we have that capacity to identify the affected, especially the minimum wage earners. And therefore, we provide relief for them and for the companies that employ them para the companies will not close.
So government should employ
provide
some sort of relief to the companies who
Yes.
will have to still manage its employees
Yes.
who need to go
And
on
we can
break.
go direct to the employees. That's my suggestion. There is TUPAD in the DOLE, and we can expand it, and we can fund it. And this is a really, hindi naman natin ginusto to di ba?
Yeah.
Pero ang point ko, we should manage kasi the complexion and the direction of the national welfare is essentially determined by what you do about a particular problem, about a typhoon and
How do you
about a
address it?
virus.
Yeah.
It's all about what you do about it that determines where we are going. So
There must be a lot of forward thinking here.
hindi naman sa pero ang point ko doon, sa Albay kasi, we always face typhoons.
Yeah.
If it's, if it's strong, we will prepare stronger and we will praise strongest. So, I mean, it's all about, determining what is good for your people. And ano ba yung goal mo? Zero casualty? Hindi na kasi pwede yung zero contamination, di ba? So,
All right. To Congressman Joey Salceda. Sir, maraming salamat po sa inyo. Thank you. And we'll be taking a short break still to come. Bracing for the coronavirus impact on medicine supplies and how close are we to finding a cure for the coronavirus disease. We'll speak to the Executive Director of the Pharmaceutical and Healthcare Association of the Philippines. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. Our guest today, Pharmaceutical and Healthcare Association of the Philippines Executive Director, Teodoro Padilla. Mr. Padilla, thank you. Welcome to the show.
Yes, thank you.
Tell us about your role in the government's fight against COVID-19.
Well, thank you. The Pharmaceutical and Healthcare Association of the Philippines has members who are part of the innovative pharma companies, as we call them. We are part of a global association called the IFPMA. So that's the International Federation of Pharmaceutical Manufacturers and Associations. Our members include vaccine manufacturers, those who create new medicines. And at the moment, because of the complexities of this coronavirus or the COVID-19, we are seeing an unprecedented global collaboration amongst the different companies and governments, and working with WHO, working with amongst private industry. So what's happening right now is that they are developing therapies, vaccines. I think there's some of these that have been already mentioned in the news.
Yeah.
So we're seeing
Testing them, huh?
there's testing going on, but at the same time, however, let's keep in mind that developing a vaccine is very complex. So normally, and this is in regular conditions, it takes about 10 years. However, because of the emergency, this global situation we face, what we're seeing now is that this vaccine that is being done in other parts of the world could come in about a matter of months, maybe. But again, not tomorrow, unfortunately,
Right.
but maybe around probably the end of the year.
End of the year, still, maybe.
That's right. However, nonetheless, companies that are involved in vaccine development, like companies like Roche, Pfizer, Sanofi, and GlaxoSmithKline, among others, and Takeda, are actually putting together solutions working with what they currently have, because they've developed already vaccines for other
Right.
other viruses in the past, like nCoV. I'm sorry, like SARS and MERS-CoV and H1N1.
Yeah, actually, that's what I wanted to find out. Because we had MERS and SARS, why weren't they prepared, or haven't they evolved into a vaccine that could mutate out of a MERS and SARS virus?
Well, again, these viruses can be quite complex. So one size fits
It's not
all.
as easy as we think, huh? Yeah.
No. Unfortunately, it's not like that. No one size fits all component. Nonetheless, they have similarities. And although I'm not a microbiologist or an epidemiologist myself, but what we understand is that these can actually be taken and probably modified and adapted for the situation.
So what you're estimating is, hopefully before the year ends, there's a vaccine. It looks like it's going to that by the end of the year. What are you guys doing now, aside from that, to help government, the Philippines now address the situation?
Well,
we have 33 positive COVID-19 cases.
Well, we do have, many of our members are actually involved in the distribution of medicines and particularly for care. Some of it might be, in the fields of antibiotics and all that. What we're doing right now is ensuring that the supply chain of the supplies of our medicines are actually undergoing what is part of the business contingency planning of many of our companies. And some even have what they call an emergency management plan, just to ensure that supplies are not affected.
Okay.
So,
but we're talking about supplies of medicine, of other medicines, of course, not
Sure.
COVID-19, because there's no such thing just yet.
At the moment, it's still under development.
So I want to bring this in because of what's happened, India, which is the world's biggest supplier of generic drugs, has actually restricted exports of 26 ingredients and the medicines made from them. So the restricted drugs actually include paracetamol, one of the world's most widely used pain relievers. How is that going? How is the effect of that worldwide now?
Well, that's a good question, Pinky, because what happens is those who are dependent on a single source, whether it's China or whether it's India, will have some supply constraints coming up. As a result of what you mentioned, India has already sort of clamped down on exports. Many of the products that, when you understand that many of the products also made in India use active pharmaceutical ingredients coming from China, which is like the supplier of the world in many aspects. Thankfully, because our companies have different scenarios built into their operations, they have contingencies so that in case a supplier cannot come in, they have supplies from other parts of the world, other regions, which will hopefully not also be affected by this virus. No? And at the moment, we know that they're not. So at least the concern would be mostly if, let's say, if a flight comes in and has to pass through, let's say, China, it may have to be diverted, or it should not pass through because it has to undergo strict quarantine.
They have to find another route here.
Yes.
I just want to bring this in on the COVID-19 infections because this is something that needs to be highlighted, also as a way of public service to each and every one of us. When you look at the numbers, there's really more than 80% symptoms of a bad cold are expected to recover. That's pretty high. And then you have 14% who become severely ill and 5% that are critically ill. And for the most part, the profiles are seniors with pre-existing conditions in the whole realm of other virus or diseases that have hit, obviously not the Philippines, but worldwide. How do you make out this, this pie chart we have in terms of, there's an 80% ability to actually get over the disease?
That's right. Well, looking at it as just an ordinary person, I say that this is good because at least we know that it's not considered to be immediately fatal. At least one has a chance to recover. And what's important is just to continue to maintain just the standards of health. I think
we've said it over and over again.
I know the social media that has been pushing for various, like we talked about, I think Congressman Salceda was really talking about something much more drastic earlier. But we talk about social distancing, we talk about washing hands, keeping ourselves just hygienic and just staying healthy.
Yeah.
In general.
Yeah, that's such a catchphrase though when you stay healthy, because you could be, but if you're possibly exposed to someone, again, as we said, the chances of overcoming this is really 80%. Malaki naman ho talaga.
Yeah, that's right.
But yun nga po, there are questions on social distancing and all that, especially in a densely populated area as the Philippines. And again, I just want to bring this in. Mortality rate as of March 3 is 3.4%, and the source of that would be the World Health Organization. Moving forward, Mr. Padilla, what do you advise the public, and what can we expect from the PHAP?
Well, again, let's not panic, because I think what happens is when we have very little information, or when we have, or sometimes too much information, the overload makes us think and alarms us, right? I think what we should do is let's continue to listen to the health authorities. Right. We have regular updates coming from the Department of Health, the World Health Organization, from abroad, from the CDC, and also locally, we have a lot of infectious disease specialists who are very...
Let's talk to them, right? Yeah.
Let's talk to them. I think Dr. Salvana has often been quoted, and I think he makes himself very much available, and he is a voice of calm.
All right. To PHAP Executive Director Teodoro Padilla, sir, maraming salamat po sa inyo. Thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.